morning, Dr. Orange. Today we're going to be asking you some questions about ultrasound. Can you introduce yourself?
Yes, my name is Dr. Cynthia Orange, and I am a veterinarian here at Paw Haven Animal Hospital in Winter Haven, Florida.
What training do you have in ultrasounds?
Years ago, I took a course at the Academy of Veterinary Imaging through Sound, and that course took about a year to complete. There was multiple in-person sessions and a lot of homework and practice that I had to submit. So it was pretty intensive, and at the end of that, I did get a certificate for abdominal ultrasound imaging.
What are some of the benefits of ultrasound?
Ultrasound can give us a different view into the body. So for example, an x-ray gives us a 1 second in time, 1 period of time image, whereas an ultrasound I can see into the abdomen, seeing how the intestines are moving, seeing how the blood flow is, measuring organs in real time, seeing where things are located better and in a different way that x-rays don't give us.
What kind of patients would you recommend for ultrasound?
So any patient that the veterinarian recommends ultrasound is a good patient. So usually that looks to us like a pet who got blood work and there was some abnormal values on it. So whether the liver enzymes were elevated or some of the kidney markers were elevated, we will potentially recommend ultrasound to look and see what the cause of that was. If we are worried about your pet having a foreign body and x-rays aren't clear, sometimes we'll use ultrasound for that. If your pet is vomiting all the time and there's not really a great reason, a lot of the times ultrasound will be our first line of diagnostic for that as well.
What can we diagnose with ultrasound?
The list of things we can diagnose with ultrasound is truly limitless. So anything from GI disease, so like inflammatory bowel disease, blockages in the gut, liver disease, kidney disease, tumors, and all different organs that are in the abdomen. The list just can go on and on.
Can you kind of walk us through what an ultrasound appointment would look like?
Sure. So when your pet is dropped off in the morning, they are usually fasted because we want to be able to evaluate the stomach and intestines without food in it. And when you drop your pet off, usually I will do an exam to make sure their heart sounds okay and make sure nothing has changed from the last appointment. And then if everything checks out, your pet will be lightly sedated. The majority of pets are lightly sedated, not every single one of them. And that is just to take the fear and stress away from the actual procedure. And after your pet is sedated, we will usually put them in a trough that is padded and has a blanket, something like this, and their back lays down so their belly's facing up, and that way they're comfortable during the whole procedure. And we will shave their belly so we can have good contact between my ultrasound probe and their skin, and that just gives us a better image. And the whole procedure takes about 20 to 30 minutes. It is not painful. It doesn't cause any damage to them. And then after that procedure, we usually reverse their sedation and wake them up, and I call you with results. And they usually go home by lunchtime, sometimes sooner if we can do that.
Last question. How do you book an ultrasound appointment here at Paw Haven?
Call us. So if you call us, we can get you in with an appointment with one of our veterinarians. And if you see any of them, they are more than happy to help get an appointment with me. You certainly can make an appointment with me also, and we can figure things out